This presentation will investigate a nutrition assessment for Kindman with the purpose of trying to understand if she is meeting the nutritional requirements of a healthy diet for someone her age. Kindman is 24, 172 centimeters tall, and weighs 57 kilograms. Visually, she presents as a tall and slim, and it would be easy for anyone to make the assumption that she must be healthy. It is well known that there is no one measurement process to accurately measure and assess someone's dietary patterns or nutritional needs, but more so the use of several tools and a consideration of many broad factors that will help to provide a holistic assessment. This is what this presentation will provide. I'll look into different nutritional assessment methods, those being a 24-hour food recall, a 3-day food record, and nutrition history. It will look into the issues that were encountered when using these methods for Kindman, what the strengths and weaknesses were, and how those methods could be improved, or what would have been a more suitable method to use. Comparisons will be made between Kindman's food intake in relation to her age and lifespan to the Australian Guide of Healthy Eating, as it will be interesting to see that even though she looks like a healthy individual, does her nutritional intake reflect this? I'll also provide suitable changes to dietary choices that will help her meet the recommendations of a healthy diet. Comparison and analysis of Kindman's measurements against the current Australian standards for body mass index and weight circumference. Firstly, a 24-hour food recall was conducted on Kindman. This type of nutritional assessment is recognised as the most commonly used in nutritional research to help identify food intake and nutrient intake. This assessment is both subjective and retrospective, requiring the participant to be interviewed to recall all foods and fluids intake in a specific detail for the last 24 hours. I asked the participant to recall everything she had eaten, and I was met with enthusiasm, as this sounded like an easy task. The first copy of the recall was brief, and I encountered the following issues. Measurements were incorrect and inconsistent, for example, cycling between a bowl of, a cup of, or grams. There was no mention of miscellaneous foods, things like junk food or treats. Whole meals were used without the breakdown of each food group, for example, a chicken and salad wrap, rather than explaining what items were on the wrap. Research suggests that these are all very common issues encountered with this style of nutritional assessment. In order to gather quality information, there is a reliance on the participant's age, educational status, and degree of understanding of what food and nutrition and recall capacity. As you can imagine, it would be difficult to interview a child or someone elderly with memory recall problems. The interviewer's ability to explain the needs of the assessment and the ability to probe for missing information. For example, I asked the participant if they had included sugar in the 2 coffees that they drank daily. This probing method is referred to as the multiple pass method, where you recomplete the assessment several times, asking specific questions and providing cues to draw specific. The strengths of a 24-hour recall is that it's retrospective in design, and the participant recalls food they had the day before, and therefore not altering their usual diet. This should lead to an accurate representation of food intake. The design is simple and effective. An interview usually only takes 20 minutes and can be entered straight into an app. It's precise, meaning its results should be similar if the assessment were to be re-administered. The tool has high validity, meaning it is capable of measuring food and fluid intake without errors, and therefore is commonly used as an assessment tool. Its weaknesses is its large reliance on memory recall and cognition of the participant. Reliance on the interviewer's ability to adequately explain the process and ask the right questions to obtain accurate information. A single recall doesn't always actually reflect a good indication of usual intake. It's subject to being documented incorrectly by the participant, who may not want to disclose all intake, which would seem less socially desirable. Subject inaccurate measurements are referring because you're referring to a time in the past. Quality of information gathered by these interviews will be affected if you're referencing an Australian database and that information is out of date. The second tool was a 3-day food recall. In this assessment, the participant was to record food over 3 days. Essentially, you record all foods and fluids consumed over a specific time, usually ranging from 3 to 7 days. With this particular assessment, we chose to include 1 day of the weekend to try and get some different eating behaviours. Unlike the 24-hour recall, this assessment requires the record of intake to be completed around the time of consumption, with the intention of removing any need to rely on memory recall. The weighing of foods is considered gold standard, however, it is not always feasible. When I explained the requirements of the assessment to the participant, I was met with less enthusiasm, as this would be a longer process with more time and effort required. Kynan reportedly had difficulty with having to record things promptly to avoid forgetting, which would have affected her accuracy, recording alcohol consumption, as she felt as though this would be embarrassing, recording foods that were consumed in a restaurant, unsure of the breakdown, recording weights of things accurately without having tools available. The strength of the 3-day food record is its little reliance on memory, which should improve accuracy. The records are done in the client's own time, which may reduce the need to underreport consumption. The recording process is simple. The weaknesses are that more time and effort is required by the patient. Weighted and estimated records can cause issues with accuracy. There's a reliance on the participant being motivated to record and have a certain level of literacy skills. It's affected by day-to-day food variations and food availability during different seasons. The reliability of data decreases over time if the participant loses engagement in the process. The accuracy is affected if meals are not recorded immediately, as it's common to be incorrectly recorded after the fact. This table shows a comparison between what the suggested daily intake as per the Australian guidelines versus what Kynan consumed in a 24-hour recall. As you can see, her fruit and dairy consumption are consistent with the guidelines. However, her vegetable, legume, grain, and meat intake are not. This is some practical recommendations for Kynan to incorporate more grains into her diet by having 2 slices of wholemeal toast at breakfast, with the addition of a simple spread that is not saturated in fats or sugar, like a natural nut spread. At breakfast, having muesli, 1/4 cup is considered 1 serving of grains. For lunch and dinner, incorporate 1/2 cup of rice or pasta to help boost your grain intake. Suggestions to decrease your vegetable intake is because by consuming white potatoes, that is just 1 white potato is classified as a standard serve. The recommendation would be to swap the white potato for a green vegetable or even more colourful vegetables like corn. This recommendation would bring more vitamins and minerals into your diet. Swapping out the white potatoes for legumes would also be beneficial for your diet. Decrease your meat consumption. Try protein alternatives like spelt bread for breakfast, chickpeas and other bean varieties to be incorporated into salads, or even nutritional yeast to flavour roasted vegetables, as it is very high in protein. As Kynan is lactose intolerant, is it important for her to continue with her dairy alternatives, like soy milk in her morning coffees and the Yummies branded hummus, which is dairy-free. If she is wanting to explore other dairy-free alternatives, a suggestion of dairy-free yogurt on breakfast muesli or dairy-free cheeses on salads. Kyman has a BMI of 19.26, which is within the healthy weight category. This is considered good for your health, and her focus should be on maintaining this healthy weight. Measurements alone are not accurate for assessing someone's health, as there is no accommodation for where the fat and muscle are distributed or whether you are male or female, your age, or your life stage. However, accompanied with other nutritional assessment tools like what we have explored, they can be a valid tool. Kyman's waist circumference is 69 centimeters. This measurement is important as it indicates whether the participant is carrying visceral fat on the abdomen or if it's distributed. Large amounts of fat in this area generally mean that the vital organs located in that area are immersed in fatty tissue, which causes potential health risks. Increased visceral fat has been associated with impaired glucose intolerance, hypertension, hyperlipidemia, and heart disease, all potentially life-threatening issues. Kyman's measurements, nutritional intake, and physical appearance all suggest that she is healthy and is close to meeting the Australian Guide to Healthy Eating recommendations. With an uptake of the suggested practical diet changes, as well as the continuity of her healthy eating styles and considerations for her lactose intolerance, the participant should remain healthy without increased risk of health issues.